Hi, Jessica. Thanks for agreeing to be with us today, especially during your maternity leave. So we have a few questions for you today.
Okay.
So question number 1 is, what is your current title and where do you work?
I'm a physician anesthesiologist that specializes in pediatric anesthesiology, and I work in town at Long Beach Memorial Medical Center and Miller Children's Hospital.
And how long have you been doing that?
I've been at this hospital for 1 year. I've been out of training for 2 years.
Okay, super. So when did you first realize you wanted to become a doctor?
That was a long time ago when I was 10 and my mom was pregnant with my brother. I would go to all of her doctor's appointments with her, and I was just so fascinated with the OBGYN, who was female, and she would do the ultrasounds and show us pictures of my brother when he was inside the tummy, just like my little one now. And I just thought that was the coolest thing ever, especially since it was a female doctor. So that kind of incited the passion of medicine in me at a young age.
Wow, and what made you choose anesthesiology?
I chose anesthesiology in medical school. I initially wanted to be a psychiatrist, but then I quickly learned that I wanted to do something that was a little more active with patients and involved procedures. I really liked the environment of the operating room, but I knew that I didn't want to do the actual surgery. And anesthesiology affords me the opportunity to work with multiple different patients in the ICU, in the pain clinic setting, older patients, and in my specialty, newborns and infants. So I like that I'm in the operating room. I get to work under very stressful situations. So it's like the perfect setting for me.
Wow, it sounds like you made the perfect choice. So a couple more questions for you. First, can you tell me about one of your most challenging experiences?
There's a lot of challenging experiences that happen in the operating room because things change very quickly. Sometimes it can be very boring, but other times there can be serious issues that arise. One of these issues happened to me at the beginning of this year when there was a patient who had some unexpected bleeding in the operating room. And it was very important for me to work very quickly along with the other people in the operating room, including the nurses and ultimately the surgeon, in order to help this patient who eventually recovered from this bleeding. But I would say in the operating room especially, things change so quickly, it can be very challenging.
Yeah, that sounds really stressful. I imagine you have to be someone who's very calm.
That's true.
And can you also tell us about one of your most rewarding experiences?
I love working with kids. I think that's the best part of my job. And recently I had a little patient who, as I was walking him back into the operating room, he was being really brave and he wanted to come without his parents, which is unusual. He was telling me a joke, and I thought that was just the cutest thing, that this kid who was about to have a surgery where, normal kids would be super nervous, he was just so lighthearted and just like the cutest kid, and he thought it would be funny to tell me a joke before going in the operating room. So it's moments like that that I think make my job really fulfilling and worthwhile.
Yeah, the power of the human spirit. And so last question, what advice would you give to students who are, wanting to enter the medical field?
I think healthcare is an amazing field to be in. You're helping people on a daily basis. It's hard work, but you leave work knowing that you've impacted the lives of others. I think people that want to go into medicine, especially being a physician, you really have to have passion for it because it's a long road. It's at least 8 years of training after college. So you're really 30 by the time you have a job. So you really have to be motivated and passionate about helping people to get you through all that tough training. But once you make it through, it's very much so worthwhile.
It sounds like it. Well, once again, thank you for taking the time to be with us today.
Thank you.